We wanted to kind of kick off this, as Chris said, the school districts are certainly struggling to maintain quality benefit plans and attract the best and the brightest teachers for our students out there. And the health plan is always one that gives everybody fits, but especially school districts. Greg has done a lot of work with districts and really has got kind of his finger on the pulse of what their needs are with their benefit plan, not just to lower costs, but also to maintain benefits and keep those teachers happy and showing up. So with that, I might just start off kind of the first question for the audience. What did you all do differently?
Yeah, so Dr. Rios and his team, they'd been traditionally self-funded for a long time, but BUCA carriers, and so when we came into the picture with them, we maintained that for a year or so, and then we just saw costs continuing to escalate to the point that it was, if you trended that out, it was clearly going to be unaffordable over time. And so that was about the time of my awakening to the free market movement, and I had started talking to them a year or so earlier about maybe there's a different way to do it. And when we saw those costs, I think it was 2021, and where they had gotten to, we decided to go forward and pull out a different way of doing it, which is a courageous thing because there's political implications, there's boards, there's all kinds of things that make it much more difficult to do something radically different. But Dr. Rios had the courage to do it, he and his team. And so that's what we've done. I think we have some slides if you want to pop those up. This little graph gives you a sense of where this thing was headed. So if you can see that number, AAD 905, that's the per employee per month cost the last year we were with Aetna. So if you continue to trend that up, that's what we were concerned about. And the next 2 years are, the first year we dropped that down to 764. It went back up a little bit in 23. And so far, year to date in 24, we're back down to 756. So certainly flattened that curve, but beyond cost, we made some dramatic improvements to the plan for the employees.
And that's really one of the things that we see in the free market is, flattening or reducing the cost curve while actually improving the benefits. You're really just getting those incentives aligned better.
Correct. So here's what we changed. We left Aetna and CVS Caremark. We hired an independent TPA, happened to be Jay's company, which was a great decision. We hired a transparent PBM. One of the key things we did was execute a contract with their local hospital. So Del Rio is a small community, maybe 35,000, Dr. Rios?
Within the city limits, about 38, but the county, it's larger than that.
Okay. So a relatively small community with one local hospital. So we were able to execute a contract at reasonable rates with that hospital and the physicians, which are most of the specialist physicians work for that hospital. Implemented the cash pay bundle procedure coverage at 100% coverage, and we use a kind of a narrow network for when folks have to come to San Antonio, and then we use our RBP for everything else. Anything that doesn't fall within one of those buckets, we're using reference-based pricing. So those are the changes we made. We didn't actually change the deductible. We didn't change out of pocket. We didn't change any of those things. Those stayed right where they were, which were already at pretty nice levels. We just changed and added a whole bunch of options for folks to get care that they can afford. So
that's excellent. And you mentioned this a little bit, but you might want to elaborate. Why did you feel like you needed to take this step and change course? I mean, you had mentioned that it was unsustainable, but was there other factors at work?
It was a cost for sure. I mean, we just couldn't foresee costs coming down under the structure that we had. And when you continue to trend it, it was just going to get worse and worse over time.
And that was probably the number one reason for changing. As a superintendent, whether it's myself or anybody on my team, we're overwhelmed with just hiring teachers and ensuring the curriculum is there. And over the last probably 4 or 5 years, I had learned more about healthcare, and you have find very few of us superintendents that know that much about healthcare. Everything from prescription plans to stop-loss insurance, anything you wanted to know. I learned it because it had that much of an impact on our budget, and we couldn't sustain it. I think that that's about the time that I reached out to our attorney and I said, hey, I just feel like insurance people are robbing us blind. We need to take a different course. And I happen to be lucky enough to have an attorney that just talks to me about everything. And he suggested that I reach out to their group, Coldewey's group, and we were ready for something different. So he helped us finish out. I think it helped that we had been robbed blind by the previous person. And I mean robbed blind. Just even the stop loss was just terrible. So we were ready for something different. And because I knew so much about health insurance by need, it was easy to make that transition, and it was easy to educate our board of trustees as to why we had to do it. But finances was probably the only factor involved. But now that we're there, it's just nice to hear from our employees, hey, do you know I had my surgery 100% covered? And you hear those success stories a whole lot. And that definitely helps as we were transitioning into this change.
Have you all seen a change in the way the employees view the health plan?
Absolutely. The tremendous change. They're always leery about it. And what do you mean I have to go to this doctor or that doctor? I said, no, you don't have to do that. But if you want it 100% covered, then you can do that. And it's those conversations that you have to have. But in order to have them, you have to understand the plan. And again, you're going to find very few superintendents, at least from my experience and conversations I have with them, that understand the plan. So anyway, yeah, a whole lot of buy-in now that they're getting the services.
That's great. So as you all had made these changes, I'm sure this was kind of the blueprint. Did y'all have to make any adjustments? Did y'all run into any challenges that you needed to pivot on, or maybe how you overcame those?
There clearly have been challenges, and especially in the beginning, because the thing, anytime we're implementing a plan like this, whether it's a school or anybody else, we hear, oh, my doctor doesn't take this, right? And we heard that for a bit, but that typically goes away after a while because we can work with those docs. We're paying them a fair price, and typically we can cure that situation. Not 100% of the time. I mean, we have a cardiologist in San Antonio that was seeing a number of patients from Del Rio who simply decided he didn't want to do that anymore for reasons I don't understand or know. But so that creates challenges. Those patients love that guy, and now they have to go find a new cardiologist or pay cash and get reimbursed. So challenges are always there, but for the most part, it's working very, very well, and we don't hear that kind of thing very often anymore. You may hear more than me, but...
Yeah. Yes, but one of the things that I think was essential to making this plan work was that Greg was able to execute that number 4 direct contract with the local hospital. Because, and he has a whole story about that, but the fact that he told the hospital, look, you guys are in the collection business, and you're not collecting the money, so let's just work it out to where we're going to pay you a full, and all the district employees are going to come see you, and you never have to worry about collecting from them. That was a huge success because our teachers, or I say our teachers, all our employees, go there often, and it's just a really good relationship. But I can tell you that leading up to making that happen, you just can't have the hospital come to the table unless you twist their arms. And the fact that I've been in Del Rio for now 12 years as a superintendent, I've been able to build up some political capital where I can every now and then cash in one of those chips and say, hey, look, this meeting has to happen, and it has to happen now. So I think that helped make sure it happened. But this whole system, that piece definitely helped buy in and helped make it a success.
Yeah, no question. The fact that they actually own most of the specialty care physicians in Del Rio helped because they fall under that contract. So the primary care physicians in Del Rio are very happy with the reimbursement rates under reference-based pricing. So as far as Del Rio itself, we essentially have zero provider issues there. And part of it is it's a small community. Dr. Rios leads the largest employer in the city, and so they're important to those providers, and they want to cooperate to the degree they can.
It's interesting, you talk about that cardiologist. I mean, literally 5 minutes before we walked on this stage, I was having a conversation with an individual here at the conference that was saying, it works at a hospital, and it's very, very difficult for the hospital to see anything outside of the insurance prism. And in other words, when you said you had the car, I said, well, they don't take this insurance. Well, are they really saying that they don't want to do business with the Del Rio School District? No, they're really not, because I believe that they don't really see you as the buyer as who they're doing business with. That they just can't get their heads wrapped around that these employers are the customer and they have a mission to serve the community. I don't know how you become more part of the community than the local school district. So it's a disconnect for sure.
Yeah, for sure. But part of it is this particular cardiologist is in San Antonio, Texas, which is 3 hours away from him. So that's part of it. If he was in Del Rio, we wouldn't have this issue, I don't think. But he's in San Antonio, and
yeah, I get it, but it's still a little bit frustrating that
no question.
Don't see the employer, but no. So, see, this has been a fairly big step. I mean, overall, with the results, has it been worth it so far?
Yeah, absolutely. It was a challenge, but it wasn't any more of a challenge than any change that you have to make within the school district. I would say that probably, at least from a political point of view, keeping the trustees informed before anything happens so that they're aware of it is important. And you have to have somebody who's able to do that. It's entirely worth it. Sometimes people get frustrated because, hey, that doctor said they don't take the insurance. Well, don't worry about it. That's part of the experience. But once Greg's team steps in or the person from our office and they find out that it's still going to get covered and it's going to get covered sometimes at 100%, it works great. Absolutely worth it. The other part, I don't know if it's part of the discussion, the growth in cost. If I was to ask anybody, what do you expect your healthcare costs to increase from one year to the next? Everybody's going to say, at least based on their experience, they should say 10% plus, which is a lot when you consider how much we're self-funded and we fund our employees 100%. So the numbers that Greg put up there on that slide, the district covers every bit of it. Our employees don't contribute anything unless they want to cover their families. So any hike in it, we feel it tremendously. And I think that the hikes that we've had over the past couple of years are smaller in comparison to what they had been and even what we're expecting, I think that we're projecting increases for this coming year at, I think, was it 6%?
6%.
And that is just under the inflation rate as far as I'm concerned.
Well, I hope I'm not talking out of school here, Greg, no pun intended, but you're actually doing some other fairly progressive things at the district. I know you've been focusing on some of the chronic disease states and partnering with other local independent providers.
Absolutely. So this isn't unique to Texas or Del Rio, but it is worse on the border communities. Diabetes is rampant. It is getting worse. And so I had this epiphany moment one day. I was looking at their claims reporting and just large claimants. And just back of the envelope, it looked to me like about 60% of their total cost was directly related to diabetes. And it was the heart attacks, it was amputations, it was dialysis, it was kidney failure. It was all the things that go along with diabetes. And so I'm puzzling about that and think, okay, that's a problem. What do we do about it? And that was when I got introduced to Dr. Artie. And you guys should go hear her talk tomorrow. But what Dr. Artie provides is expert endocrinology care for diabetics on a direct care basis with lots of time. And we made that available to every member at zero out-of-pocket cost. So we started that about 6 months ago or 9 months ago, and we've had amazing results so far. The problem is not solved, but we are moving towards solving that problem. So I'll give you one example because we have a video testimonial from the gentleman. This gentleman, when he started seeing Dr. Artie, had an A1C of 14.1, I think. And I don't know anything about medicine, but I know that's a crisis. That is next thing to being in the hospital. That is a serious, serious problem. 6 months later, through her care and those of her nutritionists and health coaches, he was 6 point something. He was stable. He had lost 30 pounds. So we've taken a man who was literally next thing to being in a hospital in a crisis situation, unavailable to do his job for Dr. Rios, to a place where he is stable in his health, improving continually, able to do his job, able to be healthier for his family. And so that's the kind of results we're looking for and getting. We just need her to see more of them. And so, yeah, we've done some pretty creative things, pretty creative things to attack that specific problem, because that specific problem is by far the largest cost driver on this plan.
So it begs the question, Aetna is, they're big. There are a lot of smart people there. Was this on their radar at all? Because I'm sure this diabetes, it didn't just spring up overnight.
Is that a serious question or rhetorical?
Listen, as the moderator, it's my role to prompt topical comments.
Yeah, you and I both know Aetna doesn't care at all about that. They profit from higher costs, and they want those costs to go up. So, no, they would not have embraced that idea had I brought it to them at all. That would not have been possible.
You would probably run into some sort of a contractual constraint that would prohibit you from doing something to solve the problem.
Well, since I've run into contractual restraints with them in the past over less significant issues, I am 100% sure that's true. So one of the benefits of this is we have a couple more slides that may be helpful, but one of the things we track is the out-of-pocket costs to the members, and I report that back to the board. And I didn't bring those numbers, but it's virtually nothing. The members, what Dr. Rios covers their premium cost, And then they're experiencing virtually zero out-of-pocket cost with this plan because of this. So these are all the things that they have available to them that don't cost them a penny. The local hospital and those physicians, generic drugs are 100%. If they will allow us to help them source their specialty and brand names at better prices, they can get those at 100%. They have telemedicine at 100%. I highlighted endocrinology and diabetes. They have access to Dr. Artie. It costs them nothing. Our outpatient surgeries, imaging labs, DME, all these things are available to them at 100%. So really the only time folks are experiencing this, the regular benefits, the deductible and all that, is inpatient care outside of the local hospital, cancer care, those type of things where we just don't have a bundle solution for it, but they still have relatively low out-of-pocket costs. So these members, the reason they're happy with the plan is because they're getting the care they need from high-quality providers, and they can actually afford to go do it. So that's really been the biggest benefit to the employees.
Yeah, and it's proof that, if you buy better, choose more wisely, that the plan can afford to take the participant completely out of the cost share, and still save money. That's got to be a powerful recruitment and retention tool.
Yeah, 100%. We know that if we can prove it mathematically that benefits don't really, these benefits don't really impact your ultimate cost, because your costs are driven by those high cost claimants. And so the more we can control those high costs at claim time or prevent them by good primary care, good endocrinology care or whatever, then these benefits don't really matter. They don't impact cost. It's the high cost claimants and what can we do to prevent that is driving the cost. So yeah, giving away a surgery that is $20,000 at 100 and paying for that at 100%, that would have cost us 40 inpatient, is a no-brainer. So
just at one point that you mentioned about the benefits, everybody that's familiar with education knows that there's just a tremendous shortage of teachers. And it's not because they're leaving the profession. We just have less people coming into the profession. And I've told our board over the last year that we have less people leaving the profession, and I don't have the numbers I have the numbers to show it, but I am certain that one of the big reasons they're not leaving the profession or retiring as early as they have been in the past is because of the health benefits. It's very expensive to retire and then go out there on a different insurance. So I think the type of care that entities like ourselves provide the employees go a long way in having them work longer. So instead of retiring at the age of 58, 60, 62, they're going longer. And it means a lot because an experienced teacher, the older you are, the better you are. It's just you have more experience, and we need to retain that. And I am certain that they're staying because of the health benefits.
Yeah, that makes perfect sense, and the students in the community certainly benefit from that. Well, we're about 5 minutes left. Do you all, if you don't have any other topics, you want to open it up to some questions from the audience?
Absolutely.
So you mentioned people are staying there. Have you noticed turnover shrinking? I know there's a lot of other factors involved, but just employee turnover.
Yeah, absolutely. Take my elementary schools, for example. I used to have to hire a whole lot of elementary teachers year in and year out. And for the coming year, I think I have campuses with no vacancies, 1 or 2 vacancies. So not leaving the profession, not leaving the school district is absolute. The only difficult area is that we are a border town. You could throw a rock over the Rio Grande and hit somebody in Mexico. You shouldn't do that, but you can. So we have a lot of ICE agents that bring their spouses with them, FBI. So we have that type of turnover. But as far as people leaving the profession, that number has shrunk considerably. And we know from the exit surveys when they leave. Yeah.
It's a DPC model, because I didn't see it on the agenda. Is that what it is?
We didn't decide against DPC. We would have loved to do that, but it does not exist in Del Rio, Texas. So that's item number one. We've certainly contemplated, or I haven't brought it up to him, but I've contemplated the idea of trying to bring that in. There's other factors, though. There's a handful. I mean, there's not that many doctors in Del Rio, but there's a handful of really good primary care physicians, and they're doing good work taking care of these patients. I think if we brought a DPC model in and we started trying to pull all those patients away from them, that would create some issues that we would have to deal with. So we didn't decide not to do it. It doesn't exist there at this point, and I haven't pursued trying to bring it there for those reasons.
I had a thought how, some schools may have a nurse that treats the students, but there's no nurse practitioner maybe that can help the employee population. So maybe just hiring somebody that's more qualified to treat the employee population and service the students too.
That's
I see your point 100%, but there are other factors that can go into that.
Greg hasn't brought it up, but I've certainly been approached by different organizations offering to do something of the sort. And it's primarily for the type of facility that we have and people who choose where to go to, that it's been difficult. Obviously, there's always a gimmick. Somebody wants to bill insurances for the kids where they otherwise wouldn't get it. So we haven't talked about it. I've talked about it with other people, but we've just not been ready to go there yet.
We have time for one more quick one.
How do you communicate the availability of services such as the endocrinology services to the rank and file employees?
So how do we communicate our endocrinology services? A lot of different ways. So clearly our open enrollment material incorporated that. There were direct emails from Dr. Rios to every employee. Those actually get opened. If I send them emails, they ignore them, but if he sends it, they pay attention. And so we sent emails from him announcing this opportunity. We've talked about it in board meetings. We've talked about it in every possible way. And now, and I think Dr. Artie could probably speak to it, but I think it's word of mouth now. And patients are telling others, you need to do this. So that there was a lot of different ways we tried to communicate it in the beginning, and we'll continue to do so. But primarily now it is one person telling another that I had a great experience, I'm getting better, and that's how it's growing.
So at the last board meeting, we shared some of the success stories, and the board was very clear in encouraging me to have some more of these public service announcements and share more data with the teachers and all the employees to encourage them to seek this benefit out. It's definitely one of our more popular new ideas that Greg brought.
Well, I think we're at time. So, Dr. Rios, Greg, thank y'all very much.
Thank you.
Okay.